PCOS, right? PCOS has become so common amongst women that we want to talk about this topic and educate our users, like how nutrition may help, regulate or manage their PCOS effectively. For this, we have invited a registered dietitian. She focuses on hormone balance, PCOS, and infertility. So hang on for 1 second while I bring Laura Rose, she's a RD, to join me in 1 second. All right, Laura should be here, and we are going to be talking about PCOS and how nutrition may help. Hi, Laura, how are you?
Hello, I'm good. How are you?
Great, great, great. I love your, all the beautiful graphics that you do on hormone balance and all the work that you've done. It's amazing. And we are talking about PCOS and fertility, hormone balance. These are all interrelated topics. And we have Laura Rose. She's a registered dietitian. Anything you'd like to add about yourself?
No, thank you so much for having me. I'm happy to be here. Yeah, I'm a functional medicine registered dietitian, and I'm a virtual dietitian. So I see clients throughout the country, and my specialty is in women's health and hormones. And yeah, the majority of my patients do have PCOS, which is what I'm here to talk to you about today. So I'm excited.
Great, great. So let's start with PCOS, just as a brief intro, and then we'll get into the nutrition after that.
Yeah, absolutely. So PCOS stands for polycystic ovary syndrome. It's a hormonal and a metabolic disorder that affects women. PCOS can present in a lot of different ways. So usually it may be where someone has irregular menstrual cycles or acne, facial hair growth, weight gain, infertility. It kind of presents differently on everyone, but it is the most common endocrine disorder among women. It affects approximately 10 to 25% of women, probably on the higher end, just because a lot of women aren't even diagnosed. It's a very underdiagnosed condition. Estimates of like half of women who have it aren't even diagnosed. I do have a lot of clients who've gone to, like numerous doctors without even receiving a diagnosis. So it's just something that's not really fully understood in the medical community. I mean, even the name itself, PCOS, like polycystic ovary syndrome, it doesn't even necessarily mean that you have cysts on your ovaries. So that's something even in itself, that's a misconception, that it's, actually immature follicles that prevent ovulation from happening. It doesn't necessarily mean that there's cysts. So just a lot that's misunderstood about PCOS, but a lot that can be done too through diet.
Sure. And then one of your blogs I was reading, you mentioned that PCOS doesn't only affect fertility, it also impacts other systems, right, in our bodies. Do you want to tell us a little bit about that?
Yeah, absolutely. So, well, PCOS, there's a number of different potential root causes, but one of the most common ones, and upwards of 75% of women have insulin resistance with PCOS. So it is a metabolic condition as well as a hormonal and reproductive condition. But because of that, it can have long-term health consequences, like it may potentially lead to diabetes down the road or cardiovascular disease. There's higher rates of like liver disease and even endometrial cancers. So it's just, again, something that affects the whole body, including the reproductive system.
And that's pretty scary, right? I mean, you mentioned about 10 to 25% of the women. I mean, that's a lot of women in the whole world for that matter, and I mean, we're talking US statistics, I know, but I'm sure in the rest of the world also women have as much percentage as the US has, right?
Oh, absolutely. Yep.
All right, let's just shift to now our nutrition, what you specialize in. And what are your suggestions and the framework that you tell when the clients come to you?
Yeah, so when clients come to me, they usually have a lot of misinformation about what they should be doing to manage their PCOS, because there's a lot of information out there. A lot of things that will say that you have to cut out a lot of different foods. So by the time they're coming to me, they feel that they have to cut out, you know, all carbohydrates. They have to cut out all gluten, all dairy, all like any type of food. And by the time they come to me, they're eating like a list of 10 different foods, which is not sustainable. So, but what I try to work with my clients on is having more of that balanced diet of getting more protein, more moderate carbohydrate, also having those healthy fats in there. So protein, fat, and fiber, really emphasizing those on the plate is incredibly important with PCOS, because we're really trying to manage that insulin resistance that I talked about earlier. So we're trying to get to the root of that. And in order to do that, we need to balance blood sugars throughout the day. So I do try to make sure that my clients are eating consistent meals throughout the day. So eating enough protein at every meal. Most of the women I see are not eating enough protein, and that's very, very important for balancing blood sugars. And then eating some quality fat sources with your meals too. And then moderate carbohydrates. So we don't want to have too much of the simple carbohydrates, which can spike our blood sugar levels. We want more of that slow burning carbohydrate or complex carbs that have more fiber in them. But when we have that whole combination together, we're really going to see a difference in managing that insulin resistance.
So how much, I mean, is PCOS kind of, can you reverse it, or is it like continuously you have to be on a certain diet that you're talking about? And do you test them after 3 months? How does it work?
So PCOS isn't something that's reversible. It is a lifelong condition, but it is something that can be managed through diet and lifestyle. But because it is, you know, it is a lifelong condition, we need to make sure that any dietary changes are sustainable. So again, just making sure that we're not going on any super restrictive diet, which I know can be very tempting, especially when weight gain can be a symptom of PCOS. Then it's tempting to go on, you know, a keto diet or something where we're cutting out a lot of foods. But then in the long run, that's really, really hard to sustain. And again, since we're in it for the long run, we need something that we're able to keep up with for a long period of time.
So now, in addition to diet and nutrition, are there other things that you coach as well to your clients?
Yeah, so I really look at, you know, every aspect of my client's health. So everything from diet and nutrition, as well as movement and exercise, and stress management, sleep, all of those things are very important. We need to reduce inflammation in the body is another thing with PCOS. So really managing stress is a key factor here too. So I always make sure that we have good stress management techniques, or setting boundaries where we need to set those boundaries in life. Making sure that we have good circadian rhythm, you know, so going to bed around the same time each night, waking up around the same time each morning, getting some natural sunlight to help with that. Also doing some resistance training as well can be helpful for insulin resistance too. So building lean muscle mass is really helpful as well there too. So yeah, I take a whole person approach. We also talk about like endocrine disrupting chemicals, which is another big part of the puzzle for PCOS, because there's a lot of chemicals in our environment that can interact with our hormones, and we're just seeing an exponential increase in the amount of those chemicals. So I do always try to address and see, you know, what areas we may need to improve upon, whether that's filtering water, or you know, cutting out certain fragrances and beauty products, or you know, areas like that we can help improve that.
Sure. So, and then what I'm understanding is there's no one diet, like for IBS, there's a FODMAP, just as an example, right? And then there's a DASH diet or Mediterranean diet for heart health. So for PCOS, I don't see, at least I'm not a doctor here or a nutritionist, but I don't see any labeled kind of a diet, PCOS diet per se. Is there something there?
There isn't just one PCOS diet. The other thing too is that, not every single person with PCOS has insulin resistance either. It is very prominent, but we do want to test to make sure that that's what's going on before we just immediately start, addressing insulin resistance. So if someone doesn't have that and then we, put them on a lower carb diet, that can end up stressing the body out even more. So really like getting the right testing done and understanding the root cause of what is contributing to the PCOS is important. But I think that's one of the reasons why there isn't just one PCOS diet, though, is because there's, like I mentioned too, it presents in a lot of different ways. So there's a lot of different ways to address PCOS too.
Sure, sure. So what kind of tests would you do? I mean, to understand, like you talked about the insulin resistance, someone might have it, someone might not have it. So different type of tests that one should think about.
Yeah, so testing fasting insulin is good, fasting glucose, also getting a CRP, which is just a measure for inflammation in the body. Those are good, just like baseline tests to have done. Also, luteinizing hormone, that's another one that tends to be elevated in PCOS. Another one called DHEAS, that is an adrenal hormone that can be elevated with PCOS too. So I think these are all tests that everyone with PCOS should have done, and you can just order them from your regular provider. I will say not every provider will order them, though. That's the unfortunate part of it, is that you do have to do, a little bit of advocating for yourself.
Oh, I see, I see. Or someone, kind of do consultation with someone like yourself, and then you kind of go walk them through the proper process of what the proper tests are, and then based on the testing, from what I'm understanding, then you design the personalized plan or what have you, right?
Yes, exactly. Yeah. And I can do testing as well in my practice. So if that is something that, a client has been to their doctor and they say, I've asked for these tests, but they just won't order them for me. They don't think that they're necessary, which is not uncommon. I can order them for them. And then I can also do other specialized testing, like something called the Dutch test, which can be appropriate sometimes for PCOS, and it does look at, the metabolism of a lot of hormones too, as well as, estrogen, progesterone levels, cortisol levels. So it does kind of give us like a bigger picture too of what's going on.
So it's also, I read like seed cycling, I was reading, right? It helps with hormone balancing. Does that also apply to the people, women who have PCOS, or it's just only the hormone balancing kind of a thing?
So there's actually not a lot of research to back up seed cycling. So it's not something that I personally will recommend to my clients, but seeds are very healthy. They're really, really helpful for fertility. They're helpful for hormone balancing. So you can have seeds at any point in your cycle. You don't necessarily have to have, each one depending on when you are or where you are in your cycle.
Okay.
Yeah.
And any particular vegetables, like you say, avoid nightshades or something? Is there any kind of rule of thumb for the vegetables, what to focus on and what to avoid?
I always just say trying to get a wide variety of vegetables is important. If someone has a high level of estrogen with PCOS, which again, sometimes that's the case, sometimes it's not, getting more cruciferous vegetables can be helpful. So more broccoli or Brussels sprouts or kale, cauliflower, things like that. Those can actually be helpful with just natural estrogen detox, which sometimes estrogen can be higher in PCOS when we have low levels of progesterone, which is often seen. So when we have this imbalance of estrogen to progesterone, then that can sometimes exacerbate symptoms. So just getting, a serving of cruciferous vegetables a day can be helpful for that. But otherwise, there aren't necessarily, there isn't like a blanket statement that I say for like avoid all of these if you have PCOS. It's very, very personalized and specific. I always just take an individual approach with all my clients and just see what works best for them.
No, I think that's what it looks like. Like the step number one is to really get the testing, from your point of view, if a client walks in, to get the testing done, and then based on that, that would be the plan, rather than kind of a blanket statement or start loading up on this now or avoid that, right?
No, exactly. And I mean, that is, often when people are coming to me, they may have read something online that this is what will work for PCOS, but it may not work for them. It may have worked for someone else who has PCOS, but there's so many different shades of PCOS. So we just need to make sure that we're treating what works best for us and for our root cause, and not someone else's. And that's really the most important thing with anything, any condition. We need to look at it individually, and we can't say that what works for one other person is going to definitely work for us, because we're all individual.
Yeah, no, I think Dr. Google is the culprit here. We all go there and we check up something, and we're trying to grow a herb garden in our bodies without thinking it through. Right?
I know. And I understand the temptation. I understand like just wanting some answers, because if you go to the doctor and you're not getting the answers that you need from your doctor, you're going to turn to Google, and you're going to turn to the internet. You're going to turn to Instagram to try to figure out, what you can do to help your symptoms. And then, but that can lead you down, that rabbit hole of, sometimes I see it can result in disordered eating, or just a poor relationship with food and with their bodies. So just trying to reel that back in and understand that it doesn't have to be an extreme. We can do this balance, naturally, and without needing to go to any extremes.
Sure. And how would you like to summarize to I see a lot of people joining right now. What would you like to tell them?
Yeah, just basically what we've been saying, that PCOS is very individual, and that getting the right testing done is the first step. So getting that done and asking your doctor. If they won't get it done, then going to a provider who is able to order some tests for you, and then treating it from the root cause, so that you can figure out if you are dealing with insulin resistance, if you're dealing with inflammation, if you're dealing with adrenal dysfunction, and then that's how you're going to help regulate your cycle. That's how you can help increase fertility, but that it's definitely possible to do so naturally.
Well, thank you. Anyone has any feedback on questions, you're welcome to kind of put it in the chat window. I see people joining now. We are almost ready to wrap up. We've been talking about PCOS and how nutrition and other things like exercise can help you manage it effectively and naturally. And we've been talking with Laura Rose. She's a registered dietitian who specializes in women's health, hormone balance, PCOS, and fertility. All right. Thank you so much, Laura, for being with us. I think it's great information for all the women out there. Awareness is so important. I mean, Dr. Google is a great resource, but try to reach out to some professional to help yourself. I mean, I'm not a professional. I'm not trying to advocate myself here, but I'm just trying to say the fact that, we should all try to look at what is wrong with me, as opposed to looking Dr. Google and kind of ingesting whatever we want to do that, right?
Yeah, absolutely. Well, thank you so much for having me. I enjoyed this. Thank you.
Thank you. Thank you. Bye-bye.